Hi, my name is Madison Knickerbocker. I'll be presenting on COVID-19, a collective disaster trauma. COVID-19 acted as a catalyst and conductor for a worldwide decrease in physical health, mental health, and general well-being for a large population of humans. The COVID-19 pandemic has been the most dramatic collective event of our lifetime, with more than 1 million deaths in the US alone. Next, I'll be discussing some of the main stressors during COVID-19. First, I have health-related trauma, which has to do with the loss of loved ones. The death of many family members and friends due to COVID-19 was a source of profound grief and trauma. Many people experienced multiple losses within short periods, exacerbating their sense of bereavement. Fear and uncertainty also contributed to this. We had the fear of contracting the virus, coupled with uncertainty about its impact and progression, which created a pervasive sense of anxiety. This is particularly acute for those in high-risk groups or had pre-existing health conditions. Next is economic and financial stress, job loss and financial strain. The economic downturn led to widespread job losses, financial instability, and poverty. This created a constant stressor for individuals and families struggling to make ends meet, affecting their mental and emotional well-being. Housing insecurity, fear of eviction or homelessness added to the trauma, with many people facing uncertainty about their living conditions and future stability. Next is social isolation and loneliness. Social distancing measures and lockdowns led to significant isolation for many individuals, all of us, particularly the elderly and those living alone. The lack of social interaction and support networks contributed to feelings of loneliness and depression as well. Next, I have healthcare system strain, which was burnout among our healthcare heroes. Frontline healthcare workers experienced extreme stress and burnout due to long hours, high patient loads, and emotional toll of dealing with severe COVID-19 cases. This also included witnessing a high number of patient deaths and the overwhelming demand for care. Further, many individuals delayed or avoided seeking medical care for non-COVID related issues due to fear of exposure or overwhelming healthcare systems, leading to worsening health conditions and associated trauma. Last but not least, mental health struggles. The combined effects of health fears, financial stress, social isolation, and educational disruption led to a surge in mental health issues, including anxiety, depression, and PTSD. Many people faced difficulties accessing mental health resources due to overwhelming services or stigma. Again, these are just some pinpointed trauma and stressors. There could be many more listed. During this time, we were in a state of what is referred to as sustained survival mode for almost 2 years, and this is applicable to adults and children alike. Later, I will be discussing the effects of people specifically in America, but just want to acknowledge the global impact it had. The World Health Organization says that the pandemic has sparked a 25% increase in anxiety and depression worldwide. Next, we'll be discussing the effects on development from COVID. First, school closures. The abrupt shift to remote learning affected students' academic progress and social development. The stress of adapting to new learning environments and the loss of in-person interactions with peers and teachers contributed to emotional strain. The effectiveness of Zoom learning for young children and adolescents was and is still a weird thing to think about and is obviously not as effective as engaging with educators and peers in person. Critique of the educational system aside, school is where kids really learn how to be people in the world outside of their homes and family systems. Children and parents who participated in homeschooling were really at an advantage at this time, and it really took off because parents wanted a little more control over their kids' education. The shift to remote learning exposed and widened educational inequalities. Many students in disadvantaged communities lacked access to reliable internet, digital services, and devices, or a conducive learning environment at home. The disruption of in-person schooling contributed to learning losses that disproportionately affected students from disadvantaged backgrounds, potentially impacting their long-term educational and career prospects. Next, we have social interaction. Where do kids get a majority of their social interaction? School. Children and adolescents are more likely to show high rates of depression and most likely anxiety during and after enforced isolation, like quarantine. The article that this information is sourced from suggests that it may be due to the important role of peer group for identity and support at this developmental stage for kiddos. Next is access to resources, which we kind of talked about. We're talking about basic needs such as free lunch provided by school and an expense that's now parents to worry about. The safe haven that school could provide to children. Being afraid to go outside or to the grocery store, basic needs are no longer accessible in these kids' lives. Next is childcare. Parents who are no longer working had to think of childcare, which is a huge potential stressor for families. Children and adolescents' well being is also closely linked to the physical, mental, and social health of their caregivers. This could result in children being put in unsafe situations. Parents face significant challenges balancing work, caregiving, and supporting their children's education, which added to their own stress and anxiety. Next is community. Support from community initially drastically declined. And then over time, communities strengthened and came together to support each other in all the ways that we could think of. And we started to see things like virtual graduations, virtual funerals, and drive by birthday parties. They became kind of a lonely norm in the lives of so many Americans. And on a negative note, there was a big disruption of support systems. Traditional support systems such as community gatherings, religious services, and social clubs were disrupted, and this loss of communal support further exacerbated feelings of isolation and mental distress. Lastly, we have post COVID, and we see the effects on development in kids today. Social media is huge, and last year was the first time that COVID babies went into the school system. There were noticeable deficits and atypical behavior challenges due to high levels of stress at home and other factors like reliance on electronic devices. Moving on to impacts of COVID on disadvantaged communities. COVID-19 disproportionately affected some of the most vulnerable populations in our country and exposed ugly truths that we slept on for a long time. The pandemic highlighted and exacerbated existing systemic inequalities related to race, socioeconomic status, and geographic location. Disadvantaged communities faced compounded difficulties due to structural barriers and historical disadvantages. Starting off with discrimination, we saw unfair and unjust treatment based on race, ethnicity, gender, or other traits that could play a part in poor health. Discrimination affects all aspects of health, starting with the world around a person. It can also affect a person's access to healthcare professionals, diagnosis of illness, and treatment. Next, we have protests, or more so the reaction to protests. On May 26, 2020, George Floyd was murdered by a police officer in Minneapolis named Derek Chauvin. On March 13th, it was Breonna Taylor, and on March 22nd, it was Daniel Prude in Rochester. According to the New York Times, between 15 and 26 million people participated in Black Lives Matter protests highlighting racial discrimination, inequality, police brutality, and racially motivated violence against Black people. Not only were these protests subject to excessive policing, but in May 2020, 43,000 military troops were deployed against Black Lives Matter protests nationally. Between the political climate at this time and the divide in our country over basic human rights and holding people accountable, so many people in America were left wondering, who are you supposed to trust to protect you? Further, historical trauma and mistrust of government and healthcare systems ran so deep and carried over into Indigenous communities in the United States as well. Next is access to healthcare. Members of some racial and ethnic groups are more likely to face barriers to getting healthcare in America, and people in areas with a dense population may find it hard to stay physically apart from others. Members of underserved communities, Black, Latino, and Indigenous, Native American persons, Asian American, Pacific Islanders, and other persons of colors, members of religious minorities, LGBTQ plus populations, people with disabilities, people who live in rural areas, and people otherwise adversely affected by persistent poverty or inequality. Many in these communities had less access to quality healthcare and faced barriers such as lack of insurance, language barriers, and fewer healthcare facilities in their neighborhoods. Next, I'm just going to go into more detail about how COVID affected some of the specific populations, starting off with migrants and refugees. There was a lack of access to healthcare services and fear of deportation among undocumented migrants, We saw mental health issues, uncertainties around inclusion in vaccination programs, and rising vaccine hesitancy in populations as a result of a rise in discrimination and villainization of migrants as disease spreaders. More lengthy lockdowns severely restricted their movement for work, border closures that discouraged those who wanted or needed to reunite with their families, and slow asylum processes. Lastly, fear of deportation or legal status issues also discouraged some first seeking medical help or government assistance. Next is women. Globally, an estimated 245 million women and girls aged 15 to 49 have been subject to sexual and or physical violence by an intimate partner in the first year of the pandemic. In 2020, there was an $800 billion loss in income for women around the world. Moreover, the pandemic has also caused significant delays in programs to end female genital mutilation and child marriage, resulting in an estimated 2 million more cases of female genital mutilation over the next decade that would have otherwise occurred. Next is older adults and elderly population. People stuck in nursing homes and who were dying alone in the hospital. Older adults, especially those in long-term care facilities, experienced high rates of infection and death, and the isolation from loved ones due to visitor restrictions added to the emotional toll. The strain on healthcare systems and resources sometimes led to issues with the quality of care in institutions and impacted the well-being of residents. Next is LGBTQ plus communities. They face healthcare disparities, including lower rates of insurance coverage and discrimination within the healthcare system. These issues were compounded during the pandemic, affecting access to COVID-19 related and routine medical care. Homeless populations were increasingly vulnerable. People experiencing homelessness faced extreme risks due to crowded living conditions, lack of access to hygiene facilities, and barriers to healthcare system. The pandemic exacerbated their vulnerability to infection and made it harder for them to receive timely medical care. Lastly, people with disabilities. The shift to telehealth and remote services sometimes lacked accessibility features for people with disabilities, making it difficult for them to access necessary care and services. Now let's talk about addressing the trauma from COVID. First and foremost, trauma-informed care emphasizes understanding, recognizing, and responding to all the effects of all types of trauma, including disaster trauma, and involves creating a safe and supportive environment that avoids re-traumatization. Trauma-informed care includes recognizing the widespread impact of trauma and providing services that promote healing and resilience. Next is mindfulness-based stress reduction, which incorporates mindfulness and meditation techniques to help individuals manage stress and trauma-related symptoms. And it can provide individuals with tools to manage stress and enhance emotional resilience. I think this is a great option because COVID affected us in such a physical and mental way. Next is art and music therapy, which uses creative expression to help individuals process and communicate their experiences and emotion. They also provide opportunities for clients to create art and music to express and explore their trauma experiences in a nonverbal way. Next would be community-based interventions, collaborating with organizations to design culturally appropriate and accessible interventions that can enhance the effectiveness of trauma recovery efforts. This could also be developing community programs that incorporate trauma-informed care, um, like support groups, community health initiatives, and educational workshops tailored to the needs of specific populations. So, some really important conversations started in 2020 during COVID. Advocating for policies that address human rights, expanded access to healthcare, economic support, and education are just the beginning to addressing the causes of trauma caused by COVID. I personally have just been able to feel all the feels and begin talking about things. And although COVID was a collective disaster trauma, no one person's experience was the same. We're still very close to 2020 in the grand scheme of things. Official studies are just starting to come out, aside from the articles from the New York Times and the Washington Post. COVID was deeply, deeply traumatic for so many people on such a grand scale that we haven't seen for such a long time. There's so much more to the conversation when addressing the trauma from COVID. The social impacts, like police brutality and the protests, being apart from family, not being able to graduate or attend funerals. The COVID trauma is so much bigger than one theory or approach. Um, but I think with holistic interventions and open mindedness, we can begin to address the trauma from the pandemic and work towards healing, or kind of see what that looks like for all people, big and small, in America and around the world.